a WikiVidi documentaries production. Don't forget to like and subscribe. Enjoy.
Methamphetamine. Methamphetamine is a potent central nervous system stimulant that is mainly used as a recreational drug and less commonly as a second-line treatment for attention deficit hyperactivity disorder and obesity. Methamphetamine was discovered in 1893 and exists as two enantiomers, levo-methamphetamine and dextro-methamphetamine. Methamphetamine properly refers to a specific chemical, the racemic freebase, which is an equal mixture of levomethamphetamine and dextromethamphetamine in their pure amine forms. It is rarely prescribed over concerns involving human neurotoxicity and potential for recreational use as an aphrodisiac and euphoriant, among other concerns, as well as the availability of safer substitute drugs with comparable treatment efficacy. Dextromethamphetamine is a much stronger CNS stimulant than levomethamphetamine. Both methamphetamine and dextromethamphetamine are illicitly trafficked and sold owing to their potential for recreational use. The highest prevalence of illegal methamphetamine use occurs in parts of Asia, Oceania, and in the United States, where racemic methamphetamine, levomethamphetamine, and dextromethamphetamine are classified as Schedule II controlled substances. Levomethamphetamine is available as an over-the-counter drug for use as an inhaled nasal decongestant in the United States. Internationally, the production, distribution, sale, and possession of methamphetamine is restricted or banned in many countries, due to its placement in Schedule II of the United Nations Convention on Psychotropic Substances Treaty. While dextromethamphetamine is a more potent drug, racemic methamphetamine is sometimes illicitly produced due to the relative ease of synthesis and limited availability of chemical precursors, in low to moderate doses. Methamphetamine can elevate mood, increase alertness, concentration and energy in fatigued individuals, reduce appetite, and promote weight loss. At relatively high doses, it can induce psychosis, breakdown of skeletal muscle, seizures and bleeding in the brain. Chronic high-dose use can precipitate unpredictable and rapid mood swings, stimulant psychosis and violent behavior. Recreationally, methamphetamine's ability to increase energy has been reported to lift mood and increase sexual desire to such an extent that users are able to engage in sexual activity continuously for several days. Methamphetamine is known to possess a high addiction liability and high dependence liability. Heavy recreational use of methamphetamine may lead to a post-acute withdrawal syndrome, which can persist for months beyond the typical withdrawal period. Unlike amphetamine, methamphetamine is neurotoxic to human midbrain dopaminergic neurons. It has also been shown to damage serotonin neurons in the CNS. This damage includes adverse changes in brain structure and function, such as reductions in gray matter volume in several brain regions and adverse changes in markers of metabolic integrity. Methamphetamine belongs to the substituted phenethylamine and substituted amphetamine chemical classes. It is related to the other dimethylphenethylamines as a positional isomer of these compounds, which share the common chemical formula.
Medical.
In the United States, dextromethamphetamine hydrochloride, under the trade name Azoxin, has been approved by the FDA for treating ADHD and obesity in both adults and children. However, the FDA also indicates that the limited therapeutic usefulness of methamphetamine should be weighed against the inherent risks associated with its use. Methamphetamine is sometimes prescribed off-label for narcolepsy and idiopathic hypersomnia. In the United States, methamphetamine's laboratory form is available in some over-the-counter nasal decongestant products, as methamphetamine is associated with a high potential for misuse. The drug is regulated under the Controlled Substances Act and is listed under Schedule II in the United States. Methamphetamine hydrochloride dispensed in the United States is required to include a boxed warning regarding its potential for recreational misuse and addiction liability.
Recreational.
Methamphetamine is often used recreationally for its effects as a potent euphoriant and stimulant as well as aphrodisiac qualities. according to a National Geographic TV documentary on methamphetamine. An entire subculture known as party and play is based around sexual activity and methamphetamine use. Participants in this subculture, which consists almost entirely of homosexual male methamphetamine users, will typically meet up through internet dating sites and have sex. Due to its strong stimulant and aphrodisiac effects and inhibitory effect on ejaculation, with repeated use, these sexual encounters will sometimes occur continuously for several days on end. The crash following the use of methamphetamine in this manner is very often severe, with marked hypersomnia. The party and play subculture is prevalent in major U.S. cities such as San Francisco and New York City. Contraindications. Methamphetamine is contraindicated in individuals with a history of substance use disorder, heart disease, or severe agitation or anxiety, or in individuals currently experiencing arteriosclerosis, glaucoma, hypothyroidism, or severe hypertension. The FDA states that individuals who have experienced hypersensitivity reactions to other stimulants in the past, or are currently taking monoamine oxidase inhibitors, should not take methamphetamine. The FDA also advises individuals with bipolar disorder, depression, elevated blood pressure, liver or kidney problems, mania, psychosis, Raynaud's phenomenon, seizures, thyroid problems, tics, or Tourette syndrome to monitor their symptoms while taking methamphetamine. Due to the potential for stunted growth, the FDA advises monitoring the height and weight of growing children and adolescents during treatment. Meth mouth. Methamphetamine users and addicts may lose their teeth abnormally quickly, regardless of the route of administration, from a condition informally known as meth mouth. The condition is generally most severe in users who inject the drug, rather than swallow, smoke, or inhale it. According to the American Dental Association, meth mouth is probably caused by a combination of drug-induced psychological and physiological changes resulting in xerostomia, extended periods of poor oral hygiene, frequent consumption of high-calorie, carbonated beverages and bruxism, as dry mouth is also a common side effect of other stimulants, which are not known to contribute severe tooth decay. Many researchers suggest that methamphetamine-associated tooth decay is more due to users' other choices. They suggest the side effect has been exaggerated and stylized to create a stereotype of current users as a deterrence for new ones.
Psychological.
The psychological effects of methamphetamine can include euphoria, dysphoria, changes in libido, alertness, apprehension and concentration, decreased sense of fatigue, insomnia or wakefulness, self-confidence, sociability, irritability, restlessness, grandiosity and repetitive and obsessive behaviors. Peculiar to methamphetamine and related stimulants is punding, persistent non-goal-directed repetitive activity. Methamphetamine use also has a high association with anxiety, depression, amphetamine psychosis, suicide, and violent behaviors. Neurotoxicity and neuroimmune response. Unlike amphetamine, methamphetamine is directly neurotoxic to dopamine neurons in both lab animals and humans. Moreover, methamphetamine neurotoxicity is associated with an increased risk of Parkinson's disease, an effect which partially arises through excessive cytosolic and synaptic production of reactive oxygen species and autoxidation of dopamine, in addition to dopaminergic neurotoxicity. A review of evidence in humans also indicated that high-dose methamphetamine use can be neurotoxic to serotonin neurons. It has been demonstrated that a high core temperature is correlated with an increase in the neurotoxic effects of methamphetamine, as a result of methamphetamine-induced neurotoxicity to dopamine neurons. Chronic use may also lead to post-acute withdrawal, which persists months beyond the typical withdrawal period. Magnetic resonance imaging studies on human methamphetamine users have also found evidence of neurodegeneration, or adverse neuroplastic changes in brain structure and function. In particular, Methamphetamine appears to cause hyperintensity and hypertrophy of white matter, marked shrinkage of hippocampi, and reduced gray matter in the cingulate cortex, limbic cortex, and paralimbic cortex in recreational methamphetamine users. Moreover, evidence suggests that adverse changes in the level of biomarkers of metabolic integrity and synthesis occur in recreational users, such as a reduction in N-acetyl aspartate and creatine levels and elevated levels of choline and myoinositol. Methamphetamine has been shown to activate TAR1 in human astrocytes and generate CAMP as a result. Activation of astrocyte-localized TAR1 appears to function as a mechanism by which methamphetamine attenuates membrane-bound EAT2 levels and function in these cells. Methamphetamine binds to and activates both sigma receptor subtypes, sigma-1 and sigma-2, in the brain. Sigma receptor activation by methamphetamine promotes methamphetamine-induced neurotoxicity by facilitating hypothermia, increasing dopamine synthesis and release, influencing microglial activation, and modulating apoptotic signaling cascades in the formation of reactive oxygen species. A 2015 review concluded that the behavior resulting from the use of methamphetamine is likely caused in part from the neurotoxic effects of the drug: excitotoxicity, oxidative stress, metabolic compromise, UPS dysfunction, protein nitration, endoplasmic reticulum stress, p53 expression and other processes contributed to this neurotoxicity.
Overdose.
A methamphetamine overdose may result in a wide range of symptoms. A moderate overdose of methamphetamine may induce symptoms such as abnormal heart rhythm, confusion, difficult and/or painful urination, high or low blood pressure, high body temperature, overactive and/or over-responsive reflexes, muscle aches, severe agitation, rapid breathing, tremor, urinary hesitancy, and an inability to pass urine. An extremely large overdose may produce symptoms such as adrenergic storm, methamphetamine psychosis, substantially reduced or no urine output, cardiogenic shock, bleeding in the brain, circulatory collapse, hyperpyrexia, pulmonary hypertension, kidney failure, rapid muscle breakdown, serotonin syndrome, and a form of stereotypy. A methamphetamine overdose will likely also result in mild brain damage due to dopaminergic and serotonergic neurotoxicity. Death from methamphetamine poisoning is typically preceded by convulsions and coma. Psychosis. Abuse of methamphetamine can result in a stimulant psychosis which may present with a variety of symptoms. A Cochrane collaboration review on treatment for amphetamine, dextromethamphetamine, and methamphetamine abuse-induced psychosis states that about 5–15% of users fail to recover completely. The same review asserts that, based upon at least one trial, antipsychotic medications effectively resolve the symptoms of acute amphetamine psychosis. Amphetamine psychosis may also develop occasionally as a treatment-emergent side effect. Emergency treatment. Acute methamphetamine intoxication is largely managed by treating the symptoms, and treatments may initially include administration of activated charcoal and sedation. There is not enough evidence on hemodialysis or peritoneal dialysis in cases of methamphetamine intoxication to determine their usefulness. Forced acid diuresis will increase methamphetamine excretion, but is not recommended as it may increase the risk of aggravating acidosis or cause seizures or rhabdomyolysis. Hypertension presents a risk for intracranial hemorrhage and, if severe, is typically treated with intravenous phentolamine or nitroprusside. Blood pressure often drops gradually following sufficient sedation with a benzodiazepine and providing a calming environment. Antipsychotics such as haloperidol are useful in treating agitation and psychosis from methamphetamine overdose. Beta blockers with lipophilic properties and CNS penetration such as metoprolol and labetalol may be useful for treating CNS and cardiovascular toxicity. The mixed alpha and beta blocker labetalol is especially useful for treatment of concomitant tachycardia and hypertension induced by methamphetamine. The phenomenon of unopposed alpha stimulation has not been reported with the use of beta blockers for treatment of methamphetamine toxicity.
Addiction.
Current models of addiction from chronic drug use involve alterations in gene expression in certain parts of the brain, particularly the nucleus accumbens. The most important transcription factors that produce these alterations are delta FOSB, CAMP response element binding protein, and nuclear factor kappa B. Delta FOSB plays a crucial role in the development of drug addictions. Since its overexpression in D1 type medium spiny neurons in the nucleus accumbens is necessary and sufficient for most of the behavioral and neural adaptations that arise from addiction. Once delta FOSB is sufficiently overexpressed, it induces an addictive state that becomes increasingly more severe with further increases in delta FOSB expression. It has been implicated in addictions to alcohol, cannabinoids, cocaine, methylphenidate, nicotine, opioids, phencyclidine, propofol, and substituted amphetamines, among others. Delta-GIND, a transcription factor, and G9A, a histone methyltransferase enzyme, both directly oppose the induction of delta FOSB in the nucleus accumbens. Sufficiently overexpressing delta-GIND in the nucleus accumbens with viral vectors can completely block many of the neural and behavioral alterations seen in chronic drug abuse. Delta FOSB also plays an important role in regulating behavioral responses to natural rewards, such as palatable food, sex, and exercise. Since both natural rewards and addictive drugs induce expression of delta FOSB, chronic acquisition of these rewards can result in a similar pathological state of addiction. Delta FOSB is the most significant factor involved in both amphetamine addiction and amphetamine-induced sex addictions, which are compulsive sexual behaviors that result from excessive sexual activity and amphetamine use. These sex addictions are associated with the dopamine dysregulation syndrome, which occurs in some patients taking dopaminergic drugs, such as amphetamine or methamphetamine. Epigenetic factors in methamphetamine addiction. Methamphetamine addiction is persistent for many individuals, with 61% of individuals treated for addiction relapsing within 1 year. About half of those with methamphetamine addiction continue with use over a 10-year period, while the other half reduce use starting at about 1 to 4 years after initial use. The frequent persistence of addiction suggests that long-lasting changes in gene expression may occur in particular regions of the brain, and may contribute importantly to the addiction phenotype. Recently, a crucial role has been found for epigenetic mechanisms in driving lasting changes in gene expression in the brain. A review in 2015 summarized a number of studies involving chronic methamphetamine use in rodents. Epigenetic alterations were observed in the brain reward regions, including the ventral tegmental area, the nucleus accumbens, the dorsal striatum, the hippocampus, and the prefrontal cortex. Chronic methamphetamine use caused gene-specific histone acetylations, deacetylations, and methylations. Gene-specific DNA methylations in particular regions of the brain were also observed. The various epigenetic alterations caused downregulations or upregulations of specific genes important in addiction. For instance, chronic methamphetamine use caused methylation of the lysine in position 4 of histone 3 located at the promoters of the CFOS and the CC chemokine receptor 2 genes, activating those genes in the nucleus accumbens. CFOS is well known to be important in addiction. The CCR2 gene is also important in addiction, since mutational inactivation of this gene impairs addiction. In methamphetamine-addicted rats, epigenetic regulation through reduced acetylation of histones in brain striatal neurons caused reduced transcription of glutamate receptors. Glutamate receptors play an important role in regulating the reinforcing effects of drugs of abuse.
Brought to you by WikiVidi documentaries. Would you like to know more?